some of that general terminology. We have a knee joint, so remember, knee joint is highly modified. It doesn't have an entire wrapper or capsule like most synovial joints have. So that's not on your list to know. We turn around, we've got this space. Once we cut it open, you can see the bones literally fall apart. So what's the name of that space between the bones? We have a list of features there, top of page 48. Not the space. What's the space? Joint cavity. It's that easy. The space is the joint cavity or synovial cavity. And I can't put a pin in a cavity, so I put a paper towel in there. What normally fills that space in living joints? Synovial fluid. And again, that's all gone because we've cut the joint open. So I put a paper towel in there and I say, name what would fill the space the paper towel is in. You say synovial fluid. What produced that synovial fluid?
Synovial membrane.
The synovial membrane. And that I can put a pin in. If we kind of pull the bones apart, you can see there's this thin layer of stuff. It also lines the inside of the joint cavity. We're going to pull it apart. It's easy to put a pin in there. It's semi-transparent. It's not there for strength. It's there to be producing that lubricating synovial fluid constantly throughout your life. Well, you can look at the bone and see what color normal bone is. And then you look up here where the bones are articulating, and you see that shiny white stuff. What's that shiny white stuff?
Particular cartilage.
Particular cartilage. And you can see it cut edge on. You can kind of see how thick it is. It varies in thickness. And remember why synovial joints have articular cartilage. 2 reasons. Cartilage is softer than bone, so it absorbs some shock as you take steps. And cartilage is smoother than bone, so it reduces the friction as these joints are flexing and extending 1,000 times a day. What are the names of structures that tie bones together? Ligaments. And you can see we don't always get a knee joint, but we do here, and we actually got a little bit of the patella there. So the patella's got to be connected to the patellar ligament. And you can see that thick band right there. What type of tissue is a ligament? Take a look at the color.
White fibrous.
White fibrous. So you can see where it got its name. It is white, shiny white, and you can see those bundles of collagen, that fibrous nature. What's the other name for white fibrous tissue?
Dense irregular.
Dense regular. It's collagen bundles.
Oh, regular.
Nice parallel array. Since this is a knee joint, we also have the cruciates that were cut. And you can kind of see the same thing there. It's that tough, thick band which helps pull the bones together. Any questions about synovial joint structure? As long as we've got the bone, we go ahead and review bony terminology too. What's the name for the shaft of the bone? Diaphysis. And I can put a string around that. If I put the string around the very end of the bone, that's the epiphysis. And then where it tapers, that tapered region is the metaphysis, if I put a string around it. Diaphysis, shaft, epiphysis, the end, and the tapered part right there, metaphysis. And you remember that at the metaphysis we had this white thing here. What's that? Is it the epiphyseal line or the epiphyseal plate? How are you going to tell the difference? Take a close look. What color is it? See the white? If it's white, that means it's cartilage. And if it's cartilage, then it's still an epiphyseal plate. So what type of joint is the epiphyseal plate? Cartilaginous. It's got cartilage. It's compared to cartilage. They usually butcher animals before they're fully mature. And you can see this one, it's not white all the way through. It's not very thick. It's starting to turn dark in the middle. If we'd come back in 6 months and butcher this animal, it'd just be a dark line across there. And then it would be an epiphyseal line. What type of joint is the epiphyseal line?
Bony.
Bony, sure. You got 4 categories of joints: fibrous, bony, cartilaginous, synovial. There's obviously no space there, not synovial. Cartilage is gone. There's no fibrous tissue. It would just be bony. 2 bones would fuse together, the end and the shaft. Okay, listen here. What type of bone on the shaft? Compact. What type of bone is the fifth?
Spongy.
Spongy. Okay. What's this space called?
Marrow cavity.
a marrow cavity, or we should learn a new name for it, the medullary cavity. Medulla means marrow. And what's this white stuff that fills it?
Marrow.
What type of marrow?
Red marrow.
Not in a
Yellow,
shaft. In
yellow.
adults. Yeah, look at the color. Yellow marrow. And what type of tissue is yellow marrow?
Adipose.
Adipose. You can see it's fat. That's why we use bones for soups and stews. They add lots of flavor and texture, and your dog loves to chew on these because they got all that energy inside, that energy-rich fat. Yep. What type of marrow do we have at the ends of the bones?
Red.
Red marrow. And if this was a fresh one, this is the first semester we'd use this, it would still be oozing red. All that marrow would be oozing those 2 million red blood cells that you're making every second. Okay, let's look on the outside. I got out a scalpel line to scrape off this layer that's on the outside. What is that?
Periosteum.
The periosteum. Remember, it's dense, irregular, fibrous connective tissue. It's fused to the bone. That's important because the tendons and the ligaments all fuse to the periosteum, and that's literally what holds your muscles and bones together, keeps your musculoskeletal system attached. Any questions? If not, if you want to get your gloves out, you can play with this. You can smell it's fresh, it's not preserved. So I'll have to stick it back in the freezer tomorrow, and then I'll pull it out in 2 weeks so you can look at it again. But I always put it on the exam and use strings or pins or paper towels to ask you some of those features that we just went over.